Good evening, everyone, and thank you for being here with us for the very first town hall meeting with the hospital, our health network CEO, and our community. We are super excited to be together, and I'm looking forward to introducing you to my colleagues in Dr. Rietsema and Mr. Hickey, our CFO and our COVID specialist over the last few months in Dr. Rietsema. So the first thing I wanted to be able to share with you is my gratitude and my appreciation for everything that you have done for CVPH over the last several months. You've been a wonderful support to our people, you've been a wonderful support to our patients, and we wouldn't have been able to weather this without you. I am a firm believer that there are two things that people give that make an enormous difference in how we operate, who we are, and how we survive difficult times, and those two things are time and effort. They're very precious, they're very special, and you have handed those to us over and over and over again. The second group I'd like to thank are the team here and the employees at CVPH. My folks and our people are absolutely spectacular. They've done a beautiful job through all of this. They do a beautiful job every day. They have a true passion for caring for this community, and they feel privileged to be a part of the care that they provide to you every day. So we are glad to be together. We are grateful for everyone. Thank you, and we will turn it over to Dr. Brumstead.
Thank you very much, Michelle. And let me piggyback on what you said as far as thanking people for joining us tonight. We really appreciate your interest and your time. And to the great CVPH team, thank you for taking your time to share information. Also, going along with what Michelle said, in our entire network, as healthcare providers, we've really benefited from the engagement and the appreciation and the heartfelt gratitude that has come our way from our communities. It's been a tough time for everybody, and it's been a really tough time for those of us delivering healthcare. And I just can't overemphasize can't tell you how much it means to our people in 2 states across a real big geography to have those expressions of gratitude. It really has been supportive and helpful. So thank you so much for that. I just want to remind you who we are, excuse me, as the University of Vermont Health Network. We're CVPH, Alice Hyde, and Elizabethtown Community Hospital in Northern New York. We're also 3 hospitals in Vermont, the Academic Medical Center in Burlington, UVM Medical Center, Central Vermont, and Porter Medical Center. All of the physicians that used to be employed by any of our hospitals now are part of one network-wide medical group so that they can work more collaboratively to serve all of us. And in the Burlington, Vermont area, we have a home health and hospice organization. And certainly over time, we'd like to extend our ability to deliver those kind of services in all of our regions. And it doesn't matter if it's Northern New York or in Vermont, all of our hospitals are part of statewide disaster recovery planning and disaster preparedness. And so each of our hospitals was very much tied in when the pandemic hit to stand up a command center. And so we're this family of organizations, and we had a decision early on, do we have a network command center? And the decision was no, those types of important actions need to be taken close to the action where people like Michelle and Chris and Wouter really could make the best decisions for each community. But what we wanted to do is get the value of having the expertise of all of us collectively. So we set up a coordination center. And I asked Al Gobey, our Chief Operating Officer, and Dr. Howard Shapiro, our Chief Population Health and Quality Officer, to co-lead that coordination center. And that's the way we've managed to this point. And it allowed us every single day, every single afternoon, for leaders from all of our organizations to come together to talk about what was happening on the ground in each of our organizations, what we were seeing as far as patients and patient needs, And it created so much value and buzz that other organizations that aren't even part of the UVM Health Network joined those calls and brought a lot of good information. So what really came out of that coordination effort were some really important things. You all know that supply chain across the country really still isn't back hitting on all cylinders. Well, for important things like the pharmaceuticals that we need and the PPE, the personal protective equipment that we need, supplies ran real short. And even an organization the size of UVM Health Network, the vendors weren't answering our calls. And so we needed to step up and get even more scale with the help of our states, mostly Vermont in this situation, because we joined with Vermont and in New Hampshire, Dartmouth, and came together as a collaborative. And we were big enough at that point with our New York entities also to have the vendors answer our phone calls. So that scale was incredibly important. And then came actually, we quickly centralized our warehousing and our distribution of those pharmaceuticals and those supplies. And there wasn't one instance, including the academic medical center, where supplies weren't needed from some place we had them, that they had to be moved to another place that was running short. And so that sharing of supplies and just having the scale to get supplies from the vendors was a real value in this at the network perspective. And the other thing is we could come together collectively and have a unified approach to important policies that were impacting us, changes in visitation, changes in the way that PPE and pharmaceuticals could be used. And it was such a rapidly evolving and creating so much anxiety that just by putting our stake in the ground collectively as a network, we tended to reduce the anxiety, particularly among our people. And I trust what I've heard back is that we reduced anxiety of the people in our communities as well. Like the rest of the world and the United States, there's been a big financial economic hit, and I'm sure Chris will get into some specifics on this for CVPH. At the health network level, this is a big deal. We've had to do some things, non-people things, to really reduce expenses. Unfortunately, we've had to do some people-related things as far as reducing salaries and holding back variable compensation and a number of other things to reduce expenses. And even with that, at the end of this fiscal year, which is September 30th, we expect the UVM Health Network to lose probably in the $30 million range. That's really, really tough. We have gotten a lot of federal assistance to this point, and continued watching our expenses. That hole might get a little bit less shallow, but it's certainly going to be a hole at the end of this year. We're going to have to work really hard in fiscal year 21 and fiscal year 22 to get back to a place where financially we're able to provide the comfort level and the support that will be able to deliver healthcare for the region. The last thing I'd say is, in my position, we got great people like Michelle and team to look at what's happening today and what's happening over the next couple of months. My job really is to look out even further than that. So what's on the horizon? We really pulled back the reins of capital spending. If it wasn't busted and related to providing care for patients, we haven't spent the capital the past several months. The one thing we have kept going is EPIC, the electronic health record. And when Wave 3 is done and CVPH and Alice Hyde and Elizabethtown are on the EPIC platform, all of those organizations I mentioned at the beginning, one record for our patients, wherever they intersect with us, will have the same information. And that's Dr. Rietsema, November of 21, right? Okay, there we go. So that's one thing. Telemedicine is something that we built the infrastructure And because of social distancing and not having people come into the office, that's just escalated dramatically. We really want to keep that going. That's a real crowd pleaser for our patients and for our providers. And the last thing that I would just mention, because you'll be hearing more about this, you know, as a collective of healthcare organizations and all in on improving the health of our population, we can't do that and be honest with ourselves if we're really not pushing on the systemic racism that's embedded in our country and the impacts that that has on healthcare disparities and variations in people's access. And those disparities and outcomes are well described. And as a family of healthcare organizations, we're going to be doubling down and tripling down on all aspects related to diversity, equity, inclusion, whether it's inside of our tent or it's in our communities where we are seeing those disparities and outcomes. So I'll leave it there, and I'm certainly going to be on and answer any questions you want to pitch to me at the end, Michelle, but back to you.
All righty. So technology is a fun thing as we're all learning, and we want to let people know if you'd like to ask a question during our presentation, to please use the Q&A option at the bottom of your Zoom window. We'll do our best to answer all the questions at the end of the webinar, and if you'd like to ask a live question on video, please use the raise the hand option found under the more at the bottom of the window. So thank you, Dr. Brumstead, greatly appreciated. And Wouter, we will pitch to you.
Thank you, Michelle. Sort of odd, we've been doing so much teleconferencing, but usually I can see who I'm speaking with. So I trust that there are people out there, and happy Thursday evening to all of you. I was thinking back, and sometimes it's really hard to remember what this felt like in early March. You know, I think the one thing I do remember at a very visceral level was the fear. We were all, and you were all, everybody was afraid. Its fear is not something actually that in hospitals we tend to engage in very often. You know, we feel in control of our domain, and uncertainty we're used to, but fear is not something we deal with. And so it was pretty interesting on a daily basis where, you know, thinking about what is this going to be like? You know, my personal fears were we going to get into a situation where we were going to have to, you know, decide who got care and who didn't? And we had meetings and discussions and plans about that. There were certainly plenty of nights, as John referred to, where I went to bed wondering if we were going to have enough PPE. I will say, as John pointed out, the network supply chain kept us in PPE and continues to do so, and we are well supplied. But that was a real fear, and one that, you know, I think across the country is still out there. You know, if the surges across the country don't come under control, you know, this is not, PPE is not a done deal yet. But I can't say enough about the network supply chain and where we are at this point. You know, we're feeling probably better off than many. You know, as far as our teams, despite the fear, because everybody had it, the fear of PPE, the fear of getting this, the fear of bringing it home to our families, you know, everybody did their job. We're professionals. We come in, we take care of patients, we do what we need to do, and our teams did that. You know, not only the teams that were involved in COVID care, in our ER, in our ICU, and on our COVID unit, but, you know, we had other patients in the hospital, not nearly as many as usual, but we had them. And everybody did their job, and everybody did their job professionally. There were lots of good things that happened. I think, you know, we had 4 people die of COVID, but more importantly, nobody during that time, COVID or not COVID, died alone in our hospital if there was someone that wanted to be with them. And that was pretty important to us, and we were able to do that. I think that's one of the things we're pretty proud of. We also didn't see infections in any of our people involved in COVID care. We have certainly had people test positive. We had a couple of people very early on who did get infected as a result of in our clinics before we really were into it. But the PPE, the way our teams used PPE and the care everybody took meant that nobody got sick as a result of caring for known COVID patients, and that I think is something to be proud of. You know, we learned a ton, a lot of really good things. One of the things we learned is how to have a much closer partnership with our local health department. It's not that we were not friendly, but we certainly have partnered in a much closer way with our county leadership, with our health department, certainly partnering in contact tracing and testing strategies. And those partnerships continue. If we get into another surge and we have to have a very busy testing site, we have plans with the county to put up a testing site to meet the needs. So, and I don't expect that will change. Certainly it won't change for the duration of this pandemic, but I think those relationships will be fruitful in other areas. We've also had regional partnerships with providers. John talked about the network calls. Oh, I've also participated in a number of ongoing calls with physicians across the Adirondack region about testing methodologies, testing priorities. A lot of this is set for us by our governor, but not all of it. And so just really good partnerships. John alluded to what we've learned about telemedicine. I think, as many people have said, we did in about 3 or 4 weeks what people have been trying for 10 years to accomplish and couldn't do it. And we certainly hope that the people that pay us to provide care, and I mean Medicare, Medicaid, and our commercial payers, continue to pay us to provide telemedicine when it's appropriate, and it turns out to be appropriate quite a bit. Obviously, our clinical teams know a lot more about taking care of COVID now than they did in the beginning. That's true across the country, we've got the tools. One of the things that is really cool and a number of patients have benefited from is that we participate in a study by the Mayo Clinic to collect plasma from patients who have had COVID. We store it, it's good for a year, and if someone comes in and is sick enough to meet criteria, we give them plasma. And actually, since we've been up, the patients that we've given plasma to have all done well. It has only been a handful, fortunately, but it's certainly, the evidence is pretty clear that it helps, and we're pretty happy to have that available to our community. And really to the 3 northern counties, the patients that really get sick with COVID come to us from Essex, Franklin, and Clinton counties. We developed an incredibly detailed surge plan. We had surge plans before. We've had emergency preparedness, but to be honest, I don't think anybody had surge plans that were really ready to go for this, and that was a lot of work. And now we have an extremely detailed surge plan, and hopefully we won't have to use it this fall, but it will be useful because we know that influenza pandemics are possible, and this is the 3rd coronavirus not pandemic, I'll say, but it's the 3rd severe coronavirus, and I don't think there's any reason to think we won't have a 4th and a 5th over the years. So hopefully they won't be as bad. The other thing that we've learned is that transparent, evidence-based leadership matters. And I think Governor Cuomo gives us an example of that every day. You can like him, you can not like him, you can agree with everything he does, you can not agree with everything he does. But the one thing, he tells the truth, he tells the truth directly. And if you want to, he's not a bad guy to model, leadership after for situations like this. Right now, where are we? We're really in the space of how do we get people that need care back into the organization. I'm not going to talk about finances because everybody that knows me knows I'm not the guy to talk about that. That's Chris's job. How do we get people back into the organization, and how do we do it safely? And those are our primary goals. And, I think one of the things that we have to acknowledge is that when our primary goals are to get you back for care, but to do it safely within the constraints that we have, it's not always the most convenient. We certainly have had a struggle to move to all appointments for just things as simple as lab work and radiology. We weren't set up to that, but when we started doing more lab work and radiology and we had people piling up at our front doorstep, we realized that that we had to do something differently. We're learning as we go. I think not everybody's been happy with it, but we're getting better every day, and we will continue to get better at that. If people have been frustrated, I'm certain there's people here who might have had themselves or others be frustrated with the lack of convenience in that, and we're sorry for that. Our overriding goal is safety, and will continue to be. I will point out that what I tell people when they ask about it is, CVPH, and I'm sure this is true for LSI, and I'm sure it's true for the medical center. I view the hospitals in this network as one of the safest places you can possibly be. Everybody uses PPE. Nobody walks around this hospital without a mask. Everybody is screened when they come in. We know that we did not see infections of our people. So I view the hospital as an extraordinarily safe place to be, certainly safer than many places in the community. And so that's what I tell people every day. As I said, safety has a price with it, especially in this environment. We're still figuring out how to handle over 1,000 calls a day to schedule things, and we're learning as we go. The last thing I'll say is, and I say it every day to our people, wherever I am, we can't pat ourselves on the back. Unlike many battles that we might be in where the vanquished puts his tail between his legs and walks away, this virus doesn't do that. And it's just always waiting around, right around the corner. I think we're now in this sort of flat period where we have a case or two in our county every day. Remember, for every case we diagnose, there's probably 10 others not diagnosed out there. Now's not the time to fall into the trap of complacency. I get a lot of calls from people. I had a call this afternoon from someone in our community saying, we have a bunch of people that get together for dinner every month. I said, how many people? And she said 25, and we're all over age 65. And I said, you might want to delay that till sometime after vaccination. And she was sort of struggling with that. And I said, look, for those of you that remember the old HIV epidemic, one of the things we used to say is, when you sleep with someone, you don't just sleep with them, you sleep with everybody they slept with. COVID is a little bit like that. When you meet with someone, you're meeting with them. They might be asymptomatically infected, and really you're meeting with everybody that they've been interacting with. And we all need to keep that in mind. The last thing I'll say is, we hope there won't be a surge. I think one of the things that gives us a bit of comfort is we know that we have a state government, a state Department of Health that is watching things like a hawk. If any of you go to the New York Forward website, it's really good. It has an incredible amount of information about what's going on in our communities. And I watch it every day. I log into it every morning to see what's going on. And I encourage you to as well. So last thing, we started this week, we are a New York free testing site. So folks that have to get tested for occupational reasons, can avail themselves of that. It's just a couple of days a week, but it is free. It's all performed on the state's nickel. We obtain the specimen, and it gets sent out to a commercial lab. You know, the downside is that all of our testing across the region is slower than it was about a month ago, and everybody needs to understand that. All of the testing that's going on down south is taking a tremendous toll on the testing infrastructure, and we've seen turnaround times get up there. So people need to be prepared for that. The state free testing is about 5 to 7 days is what they promise. I'm not convinced they even can meet those promises, but we will see. So the best strategy is social distance, wear a mask, and don't get in situations where you have to get tested. So with that, I'll finish up, Michelle, and turn it back over to you.
All right. So I'm going to pull you back in, Wouter, for 1 second. We have a great question from Bob Parks that asks, has the network started reporting data to the White House, federal database instead of the CDC? And what are our thoughts on this change?
The answer to that is yes. We had to turn on a dime. I think that started today or yesterday. I'm not sure. My thoughts on that, I will not go near the political thoughts on that. Anytime you move to an entirely new reporting system, you run the risk of not being able to compare data over time. And I think that's risky. I think that's problematic. And I don't quite understand any legitimate scientific basis for it. So I'll leave it at that.
I would agree with that. I would just correct that it's not going to the White House. It's going to the Agency of Health and Human Services, but it's not going to the CDC. And I would just echo what Wouter says. There's great statistical power in being able to look longitudinally at information over time. And it's not just this pandemic that the CDC is comparing to this. So I think there's a real potential to scientifically and statistically lose something in this move.
All right. So before I turn it over to Chris Hickey, who's going to talk about the finances of CVPH, I think it's really important to recognize from a financial perspective that our entire community has been impacted financially, and that there are lots of businesses in Plattsburgh and the surrounding areas that have been struggling. And Gary Douglas has paid from the Chamber of Commerce a very kind compliment to myself and to John Remillard, and I want to make sure that we acknowledge the role that the Chamber has played in supporting CVPH and all of the surrounding organizations and businesses who have struggled through this incredible time as well. So thank you, Gary and team. Chris, all yours.
Great, thanks, Michelle. Obviously, there's a lot of numbers revolving around this situation for sure, and I'm not going to bore you with all of them, but I'll try to pick out a few kernels that'll give you a sense as the impact that CVPH has incurred over the last 4 months. I mean, obviously, our key is sustainability. It's all about sustaining this organization, to be here when the community needs it. We went into this in a difficult situation. We were losing just over $6 million year to date at the end of February. And so we weren't in a position of relative financial strength. So it made it all that much more challenging to really, weather this. And, I can say that I think we've done a great job of weathering this for sure. So far for the months of March, April, May, and also I have preliminary June information. Our revenue has been impacted to the tune of over $30 million. So $30 million less revenue than we expected. In the middle of March 17th, 16th, 17th, we were told to stop all elective type of business. And that's important to us. Elective business is a lot of the times where the slim margins in healthcare are achieved. And so we ended up losing $30 million due to that. We implemented what we call a sustainability plan, which is really multifaceted. So it includes expense reductions. Our expenses over the last 2 months, May and June, have been more than $2 million less than our normal expenses. So we've done a lot of initiatives, as Dr. Brumstead alluded to in the beginning, that across the organization, from pay issues to benefit issues to supply expense issues, all in an effort to really reduce the expense as much as we possibly could. We also got great support from the government. We are one of the luckier organizations. We have received more dollars than any other hospital within the network, including the medical center. We've received over nearly $31 million in federal support associated with that. Now, we're going to need it. We're going to need every dime of that. Our revenue has improved greatly over the last couple of months. I track the revenue based on a percentage of what it was historically. In the month of May, it was 66% of what it normally would have been. In April, it was down in the low 50s. And right now, we're hovering at around 85%. So we're not there yet. There's still a long way to go. I think Wouter makes a real important point on, the hospital's a safe place, and we need to be able to get our business back to what it was pre-COVID. We talk a lot about the new normal and what will the new normal be. Our sustainability plan is about matching revenue with resources. And it's a real difficult process when you don't necessarily have a good history. Dr. Brumstead talked about looking at trends over time. Finance people are really good about looking at trends over time. This is a real curveball to that. This is unprecedented in terms of the impact on lost revenues. So we don't know how the revenues are going to come back. We're working on restructuring the way we operate and the way we do things and what our staffing structures are, all in an effort to make sure that we're sustainable for the long term. So that gives you a sense. Dr. Brumstead mentioned earlier about the network could lose up to $200 million when we first looked at this. We were about 50 of that, or more, between 50 and 60 of that. Now the network's going to lose between 30 and 40. We hope we're going to be only about 12 of that. So, really a lot of work in relationship to doing that. Both a combination of benefit and support from stimulus funds, but also a lot of effort associated with managing expenses. So I'll just stop there. Glad to answer any questions that you might have. I don't want to get into too much level of detail and bore all of you on a nice evening.
So Chris, while we're waiting for some questions to come in, I think it's kind of important to talk a little bit about the work that's going on here at the organization as it relates to reimagining and redesigning the work that we do here. I've been a nurse and practicing or working in this organization or connected to this organization for 30 years. It's hard for me to actually say that out loud. And I've seen us weather, many, many storms. And this place is full of generations of people who believe in a community hospital that supports the community of Plattsburgh. And at this current moment, we are working with the 2,500 people that live here and work here in our organization to help us reimagine what can CVPH look like. How do we provide the care that the community needs? How do we match the resources to the work that needs to be done here? And we're asking them to take a nice leap of faith and to believe in the mission and the vision of our organization and help us to find a new way to do business so that CVPH can continue to do the great work that it does today for many, many years to come. I talk often about the fact that I believe this organization is full of the best and the brightest. And so I have no doubt that we will find our path there. But I think it's important to recognize that even with everything that's happened with COVID, there is a lot of work to be done. And there are many, many people who are focused on trying to find a new way so that we can support CVPH into the future. So I'm looking for questions. I don't see anything just yet. We have a couple, I think, that we can pull from. So Dr. Rietsema, when will visitation return to normal for the hospital or for the nursing home?
So for the hospital, my anticipation is visitation will continue as it is until we are out of this public health emergency, whenever that is. And that will be when there's a vaccine that's effective and widely spread. It is hard for me to imagine any other scenario, because it's hard for me to imagine a scenario in which we don't have COVID in our community absent a vaccine. The nursing home is a tough one too. So Cuomo has allowed visitation. I will tell you the criteria that a nursing home has to meet to be able to allow visitation is pretty strict. I might get the details wrong, but essentially you have to have gone 4 weeks without any of your staff testing positive. And for those that don't know, we test our staff once a week by regulation. So of the CV between CVPH, I don't know if there are any nursing homes in our community that meet that criteria. I know we don't. I know that Meadowbrook doesn't, and I know that from the news, Clinton County Nursing Home doesn't. You know, as I said, COVID's in the community. It's probably most prevalent in the 20 and 30 age group, and that happens to be the age of a lot of people that work at nursing homes. So we're going to see people pop up positive. So I don't know if he'll loosen up on nursing homes in the future. I think a lot depends on what the next few months bring. I doubt it's going to be loosened up in the acute care hospital, which is difficult to be sure.
Thank you, Wouter. So if anyone has a question, please use the Q&A, the question and answer option at the bottom of your Zoom window. If you'd like to ask a question live on video, feel free to raise your hand. It's in the options under More at the bottom of the Zoom window. Dr. Brumstead, I have one for you. So the question is, COVID-19 has led to sweeping and likely permanent changes for hospitals and other healthcare providers. What will be the long-term effects for the University of Vermont Health Network, do you believe, from this?
You know, it's at the core of the UVM Health Network that we can do much better for our communities collectively by collaborating than as separate organizations. Mm-hmm. And, you know, we've all talked about examples of the way as a network we coordinated activities and collaborated with other organizations that we hadn't before. Dr. Rietsema talked about the evolution of the relationship with the County Department of Health. We had other organizations, including Adirondack Health, that joined, and Hudson Headwaters that joined in our coordination calls. So when I look back at the silver lining, and it relates directly to this question, we really collectively really got some good lessons in the power of collaboration. And I don't see that going away. I mean, there's technical things like telemedicine that Dr. Rietsema talked about, and, you know, honestly, some tightening of our belts on the expense side. But I think when you really take it away, there's regionally just going to be much better coordination and collaboration going forward.
Very nice. So I think I can take this one. Jenny Booth is asking if the community members want to donate directly to the hospital and not through the foundation, is that possible? So it's possible, Jenny. We use the foundation so that we can try to keep track of the organizations and the individuals that are providing things for the staff and for the patients. And that way we can have an opportunity to thank people. But if there's something that you want to do directly, that's fine also. Absolutely no problem. Oh, let's see. Chris Hickey, from a financial perspective, how do healthcare organizations weather something like a pandemic?
Yeah, no, that's a really good question. I think there's a couple things. One, we really, we have for months, actually, and this was prior to the pandemic, really challenging every dollar we spend. Every single dollar has, we've tightened up the control of that. I think people are tired of coming into my office because it's either Michelle or I that can approve something. Really, right down, and we're not talking about things over a certain threshold. We're talking about, anything that's out of the ordinary and not directly patient related had to get approved. So that's step number one. Step number two is, thankfully we're a part of a great network. And, the network, had great insight to go out and borrow some money. So the balance sheet right now is strong from a network perspective, and you need that to weather a storm. You need a strong balance sheet to be able to weather a pandemic like this. And that's there, and we know that the support is there to help CVPH when we need it, and we probably will. We've been buoyed by federal funding. We've been buoyed by collecting accounts receivable that's based off of a higher level than what we're spending. But that'll turn, and it'll turn, and we know we've got the network to go ahead and support us. So that's number two. And number three is, you need support too. You need support, from our payers, from the government. We would not, being able to weather this if what was predicted originally, which was a 200, network-wide, a $200 million loss, CVPH a $50 to $60 million loss. Us weathering that would have been so much more challenging if we didn't have some support from the federal government. I think everybody can always look back and say, how come I didn't get it? How come this organization didn't get it? It's a challenging process for sure. We've been lucky enough to get fairly decent support. So to me, those are two things: manage your expenses, be part of a great network, and get some support from your payers and your supporters.
Thank you, Chris.
Yep.
Wouter, one more for you. So what is herd immunity? And if I have COVID-19, will I be immune from catching it again?
So I'll take the second part first. For the most part, we think the answer to that is yes, that once you've had it, you are immune. We don't know how long that lasts. Because there's just no history to know. Mm-hmm. There you will see, if you look in the news, you will always see reports about people that had it a second time. Most of those I don't think are actually true. There's some other complicated things going on. But remember, when you have an infection that's infected, I don't know how many millions of people across the country, all diseases and all infections have really oddball things that happen at a very low frequency. But we think that if you've had it, you're immune. And certainly you have antibodies, and we know those antibodies are protective because when we give them to other people, they get better faster. So we think you're immune. We just don't know for how long. Herd immunity is when you get enough people in the community who are immune, you basically break the chain of infection. So this particular infection is pretty infectious, and the number of every person that gets it in the absence of taking measures like masking and social distancing, the average number of people infected from one infection is somewhere in the high 2s, maybe 2.8. It's a very high number. And you need to get that number down below 1. If there are more people, the more people there are that are immune, either through vaccine or illness, and we hope through vaccine, there's just not that many vulnerable people that an infected person comes in contact with. So if that number 2.8 goes down to below 1, the infection will die out. So that's herd immunity. They think that you don't start getting the benefits of herd immunity till about 70%. So think about that, 70%. That's a big number. We certainly don't want to get there by infections. If you do that kind of math, you end up with hundreds of millions of people infected, and you end up with multi-million people dead if you try to get there through infections alone. So we don't want to get there that way. But you need to get at least 70%, and ideally more like 80+%. So that's what we aim for when we start vaccinating, and hopefully we get enough people vaccinated to achieve that number. We have to. It's not really a hopefully. We have to.
We do have to. So here's an interesting question that I may need Wouter and Chris to help me answer. It says, Michelle, earlier in the spring, you participated in a chamber webinar along with John Remillard and the head of AMC, Sylvia Getman. You were incredibly calm, and I found this reassuring. My question is, how do you stay so calm when there are so many unknowns? And as Wouter said, there is very real fear. So Wouter's laughing, so I'm guessing he's probably got something to add. But I don't know how to be any other way. And my true belief is that if we get all nervous and anxious and amped up, then we stop thinking. And when we stop thinking, we stop problem solving. And when we get scared and fearful and anxious, people can feel that. And if our teams feel that, then they stop thinking and moving forward. I'm just not wired that way. Fair enough, guys?
It's true.
It's yeah. I think the only thing that I will add is the sense of support from our team and the network's team helps that. I mean, I think it's always very helpful. I mean, the team here at CVPH is a great team.
Mm-hmm.
Way more than the 3 people you see on the screen, for sure.
Oh boy, yes.
And to Dr. Brumstead, way more than from a network perspective than Dr. Brumstead, for sure. So I think, that to me helps to know we've got, if you do get into a bind, if you do get into a situation that does make you nervous, that does provide fear, a phone call away is a lot of people that can help with that.
That is very true. You're never alone. Used to have these conversations before we were a part of the network in different roles, and who do you go to and who do you talk to, and jobs could be lonely. So, calmness is one thing, loneliness is something different, and we are definitely never lonely. We are never alone, which is a great thing, really special thing. So I see no more questions coming through. We're about 10 minutes out from our hour. So I'm guessing people are ready for dinner and to maybe get home before the rain if they're still at work. So thank you all for being here. Thank you for being such an awesome group and for being so supportive of CVPH, of our network, of our community, of our people. We are grateful for you. We are here for you, ready to serve and ready to help where you need us. Have a great evening, and I hope that this is the first of many more opportunities that we will have to chat together.
Thank you, everybody.
Thank you. Good night, everyone.
Night, everyone.
Everybody.